Good afternoon. I am Dr. Vindhya. I am Assistant Professor in the Department of Pediatrics, Sree Balaji Medical College and Hospital. So, today's talk is regarding breastfeeding. So, we celebrate Breastfeeding Week in the first week of the August every year, and every year we come out with a different theme. So, why is it important? This is because despite the so much innovation in the technology, we are still not able to replace the mother's milk from the formula milk. So mother's milk is always superior and it will remain superior for the baby. So in the lecture, I'll be talking regarding the physiology of the lactation, what are the compositions of breast milk, what is the advantages of breast milk, what is the appropriate positioning and attachment. Why is it important? It is important so that mother can initiate breastfeeding immediately after the birth. She continue to sustain her breastfeeding till 2 years of life. So now moving into the lecture proper. Breastfeeding not only fosters physical bonding but it also helps in development of emotional bonding between the mother and the baby. As the breast milk contains abundant of immunoglobulins and antibody, it is the first vaccine which we provide to the baby. We should continue to exclusively breastfeed the baby for the first 6 months of life. What is exclusive breastfeeding? It means that mother gives only the breast milk. She should not give any water, sugar water, honey or any pre-lactal feeds to the baby. And once she introduces complementary feeds after the 6 months of life, she should continue to breastfeed for at least 2 years of age. Now coming to the physiology of the lactation. So here you can see that the breast contains the areola and the nipple. If you see in the areola, you have the lobule. So this lobule contains the alveoli. From the alveoli, there is secretion of the milk which enters into the lactiferous duct, and from there it enters to the lactiferous sinus and then it comes out from the nipple hole. Okay. So what are the hormones that are involved in lactation? Estrogen, it helps to stimulate the growth of the ductal system, whereas progesterone increases the size of alveoli and the lobes. After the birth, the prolactin hormone, it contributes to the accelerated growth of breast tissue. So, it helps in secretion of the milk from the alveoli. That is why it is called as milk secretion reflex. So, what is the reflex? As soon as the baby suckles on the mother's breast, what happens? There is stimulus which enters into the anterior pituitary. From the anterior pituitary, there is secretion of the prolactin which helps in production of the milk. So this is called as milk secretion reflex. And there is another hormone which is stimulated from the posterior pituitary which is called as oxytocin. This oxytocin helps in contraction of the myoepithelial cells and they squeeze the produced milk into the duct system. So this helps in milk ejection reflex. Because these hormones are dependent on the reflex, That is why if the mother is anxious, mother has sleep deprivation, she is depressed or she is worried, or if her nutrition is not adequate, this negatively inhibits the secretion of these hormone from the pituitary. That is why we need to support the mother both emotionally as well as physically for sustenance of breastfeeding. So the next topic is the composition of the and the types of the breast milk, and discuss the differences between the cows and the human milk. As soon as the baby is born, the first milk which the mother produces is called as colostrum. This is otherwise also called as liquid gold. Why is it so? So I told you already that it is having protein and immunoglobulin which will provide immunity to the baby. That is why it is called as gold. And why only gold? Why not diamond? That is because the color of colostrum is yellow. It is yellow because of the high content of beta carotene. This is produced in the first 2 to 3 days of the life. So, as soon as the baby is born, whether it is a preterm or is it a term baby, the mother will produce a yellow color thick fluid which is called as colostrum, and this will be produced for the first 48 to 72 hours of life. And if you see, the average production of the milk is around 110 to 40 ml per day. Okay, and this is basically rich in protein and immunoglobulins. After that, what happens? There is transitional milk. This milk is more mature. It is more lighter yellow in color, and it is produced from second or third day up to the 2 weeks of life. Here the mother may feel that breast is becoming full and it is more warm than previously. Then, after 2 weeks, there is production of the mature milk. This mature milk is divided as foremilk and hindmilk. Foremilk means it is basically water content. So, the water is meant to satisfy the baby's thirst, and hind milk is the one which has the fat and which is essential for the weight gain of the baby. So when we are giving the breastfeeding, we should tell the mother to empty one breast completely. That is because if the mother is giving only the foremilk from both the breast, the baby may develop foremilk diarrhea. What is it? Since the foremilk is having predominant water content, the baby passes watery stools. Okay, so the mother should empty the one breast for one feeding. So we advise the mother to give breastfeeding for 20 minutes. So she should empty one breast completely because the baby should receive the hind milk, which is essential for the adequate weight gain of the baby. Coming to difference between a human milk and the cow's milk. So here you can see that the calorie content of human milk and cow's milk is same. So what is the difference? If you see in the human milk, the predominant carbohydrate is lactose, which is 7 gram, as against 4.5 gram in the cow's milk. Okay, now if you see the protein is 1 gram approximately, which is one third of the cow's milk. In cow's milk you have 3 gram. So that means human milk is having less protein. But what is the advantage? See here you have the casein to whey ratio. So here the casein to whey ratio is 40 is to 60. That means the whey protein is higher in human milk compared to cow's milk. So what is the advantage of this whey protein? This whey protein is easily digestible. It is basically the lactalbumin and lactoferrin. So it is easily digestible, it produces less solute overload to the growing kidney. Now, in the cow's milk, the abundant protein is the casein. This casein is responsible for the colicky pain in the cow's milk. So if you have seen babies fed on the cow's milk, they'll complain of abdominal pain and even sometimes rash. So that is because of the casein content, which is 80% in the cow's milk. Now if you see the fat is almost same. It is 3.8 gram versus 3.7 gram. But what is the difference? The essential fatty acids is 13% as against 2% in the cow's milk. So, this essential fatty acid is necessary for your brain growth. And here, if you see the calcium to phosphorus ratio is more than 2, which is less than 2 in the cow's milk. Why is it important? So, if you have a ratio more than 2, this helps in calcium absorption. Okay, and osmolarity in the human milk is less, okay, one third as compared to the cow's milk. So now you can clearly see the major differences between the human milk and the cow's milk. So cow's milk is not a substitute for the human milk. We should give cow's milk only after 1 year of life. Next, what is the advantages of breastfeeding? It is numerous. So it can be divided as family benefits, mother benefits, and the baby benefits. What is a benefit for the family? So breast milk is naturally available. If you have to go for artificial feeding like the formula feeds which is available in the market, if the baby is given the artificial feed, it will cost approximately one third of the family income. And for administering the artificial feed, you will require utensils, right? So, whereas the breastfeeding is easier way, it's very convenient to feed anywhere. Okay, and breastfeeding is available anytime, anywhere. Coming to baby benefits, what is a benefit for the baby? So one is it produces an emotional and physical bonding between the mother and the baby, and it has been proved that baby fed on mother's milk, they have a better intelligence quotient versus the artificial feed. So though now the companies, formula company, they say that they are adding PUFA, that is your polyunsaturated fatty acid, but still the composition of essential fatty acid in maternal milk helps in development of better IQ, especially in case of preterm babies. So in long term, you see that the hyperactivity or dyslexia is very less in the babies who are fed only mother's milk. It reduces the infant mortality in the first few months of life by 6 to 10 times because the breast milk is naturally available, you can give any time, whereas formula feed you have to give by bottle, you need to sterile the bottle. Okay, so there are issues when you administer a formula feed. So the polyunsaturated fatty acid in the mother's milk is very much essential for the brain growth, and it decreases the risk of dyslexia and hyperactivity in the future. Now, the mother milk has the gut microbiota. What is that? So, it has the bifidus factor, and acidic pH, which leads to colonization of the lactobacillus bifidus, which helps in digestion. So that is why if the baby is admitted in newborn intensive care, the best milk which we give to the baby is mother's expressed milk. Coming to immunity. So, as I have already said, that mother's milk is the first vaccination for the baby. Apart from that, it contains components like macrophages, lysozymes, complements, which act as essential for the defense of the baby. It also have immunoglobulins, which are secretory components, and secretory IgA, which provides surface protection to the respiratory tract and the GI tract. There are mucins and salic acid containing glycoproteins which inhibits the rotavirus replication. Apart from that, there are certain factors like PABA. PABA is para-amino-benzoic acid, which inhibits the growth of malaria. You have bile salt stimulated lipase, which inhibit the growth of amoeba and giardiasis. Then you have peroxidases and lipases, which helps to fight against the bacteria. So, protein, I already mentioned that it is predominantly the whey protein, so it is easily digestible. The protein load is less. So, we saw it was 1 gram as against 3 gram in the cow's milk. So, the low solute load helps in over preventing the overloading on the kidneys. Okay, and then it also has a sulfur containing amino acids which are essential for the brain development. The breast milk is rich in binding proteins like thyroxine and vitamin D, so thereby the absorption is much better. It also contains the non protein nitrogen, and they are essential for the growth and development of the infants. So, the maternal benefits, it decreases the postpartum bleeding, it causes involution of the uterus, it decreases the risk of breast and ovarian cancer in the future, and the extra fat which get deposited causing enlargement of the breast is also decreased. So the next topic is the technique of breastfeeding and to distinguish right from wrong techniques. So first you should know what is a correct positioning and correct attachment. Positioning is how you hold the baby. So it can be easily memorized by the mnemonic chin. C stands for baby should be close to the mother's body. H, the head should be free. I means the body and the head should be in line and you should support it. And N means you bring nose to nipple. The baby opens the mouth and sucks at the breast. So there are different positions which can be adapted by the mother as shown here. So this is the cradle position. What do you mean by cradle? If the baby is sucking at the right breast, the mother supports the baby with the right hand. So same side hand and the breast is called as cradle position. Okay, so you can see here that the head is free, the head and body is in line, baby is close to the mother, and you bring the nose to the nipple, the baby opens the mouth. What is the cross cradle? Cross cradle means the mother is supporting the baby with the opposite hand. That is, the baby is sucking on the left breast, the mother is supporting using the right hand. Then it is called as cross cradle. What is a football or clutch? That is, the mother is supporting the baby's head on her palms. So, this is called as football. And then, mother can also feed by side lying. Now, coming to the good attachment. So, there are important 4 points. So, as shown in this figure, the baby's mouth should be wide open. The lower lip should be everted, it should be outside, and the chin of the baby is touching the mother's breast. The more areola is visible above than below. That is because most of the mother's areola is inside the baby's mouth, so you won't be able to see the lower areola. Next, enumerate the baby friendly hospital initiatives. So, this baby friendly hospital initiative, otherwise called as BFHI, was brought in order to protect, promote, and support breastfeeding. So, there are 10 steps that is involved. So, each hospital which are enrolled in a BFHI, they should follow these policies. Actually, they should have written breastfeeding policy. So, the first thing is the hospital should practice written breastfeeding policy. Okay, they should train all the healthcare staff in the skill which is necessary to implement the policy. All in pregnant women who are brought to the hospital should be informed regarding the benefits and management of breastfeeding. It helps the mother to initiate breastfeeding within an hour. So previously it used to be within an hour, now it is immediately after the birth. And you show the mother how to breastfeed and how to maintain lactation even if they are separated from the infants. So many times if a baby is born preterm or if it is a term baby with some sickness, the baby is admitted in an ICU. So as I've already mentioned previously that you need to maintain, that is sustain the breast milk by your milk secretion and milk ejection reflex. So here even if the baby is separated, we should tell the mother to express the breast milk, so that as the mother keeps expressing, it is stimulating the prolactin and oxytocin to increase the milk production and helps in ejection of the milk. So here the staff nurses, they should know how to maintain the lactation even if they are separated from the babies. Give newborn infants no food or drink other than the breast milk unless it is medically indicated. Why is it so? That is because introduction of prelactal feeds will help in inhibition of secretion of babies at the mother's breast. Okay, so if you satisfy the baby with the prelactal feeds, baby will not suckle well at the mother's breast. So the bonding between the mother and the baby will not develop. Then practice rooming in. What does it mean? So, as far as possible, you allow the baby to be with the mother. You should not separate the baby unless it is required. So, the baby should always be by the side of the mother, and encourage breastfeeding on demand. So, what is demand? Whenever the baby is hungry, so you will have a breastfeeding cues like baby will open the mouth, it will start thumb sucking, or it will make sound. So this indicates that baby is hungry. So follow those breastfeeding cues. If you don't give breastfeeding when the baby is asking, what happens? The baby goes for excessive crying. In that time, you have to console the baby and then the baby should be breastfed. So this is called as demand feeding. Give no artificial tweets or pacifiers to the breastfeeding infants. So you should not practice giving any pacifiers or tweets, and foster the establishment of breastfeeding support groups. So as soon as the mother is getting discharged, you establish a breastfeeding support group, enroll that mother in that group. So what is the advantage of this? If the mother is facing some practical problems regarding breastfeeding, she can share with the other mothers who are enrolled in that group. Now, what we practice is BFHI plus program. What is this plus? So, it incorporates the child survival as well as safe motherhood. So, here not only you are talking about breastfeeding, you also take care of the immunization of the baby, the antenatal care of the mother, oral rehydration therapy during diarrhea, and also acute respiratory infection control program. So, this is called as BFHI plus. So, at the end of this lecture, I hope that you would have understood why breastfeeding is important and how is it different from cow's milk. If you don't adapt to proper positioning and attachment, this may lead to maternal complications like sore nipple and breast engorgement. So, let us promote, sustain, and support breastfeeding. Thank you.